Hey, Dr. Coleman, how can someone get onto Suboxone and be successful?
Getting onto Suboxone, we use the word induction because you're taking an opioid that people have been using and letting that get out of the system and then inducting the Suboxone on so that it's filling up the receptors with this long-acting drug that doesn't really give you a dopamine spike in the pleasure center. So it's a good form of MAT to take away cravings, to prevent relapse, to help risk reduction, and to give people stability so that actually they can get into recovery long-term as well if they want to do those things. Getting inducted on it is more difficult than it used to be, frankly, thanks to our friend fentanyl, which wasn't around 5 years ago, and now it's everywhere. It used to be relatively easy. We could have people stop for 6-12 hours till they're in withdrawal, start little doses of Suboxone and build up. If you give too much Suboxone or too quickly, then you can precipitate withdrawal, where you fill up all those receptors quickly, you push the heroin or the fentanyl out, but you're filling it up with a drug that's only a 70% agonist, if that makes sense. So it's only turning the switch on about 70%, somewhere around there. And so if they're too high, on their heroin, or it's too recent, you can precipitate withdrawal. Fentanyl makes that so much worse because it lingers in the body for so long that it takes time for it to drift down and down and down and down and down before the Suboxone is easy to start taking, and you avoid that precipitated withdrawal. So induction is much harder now than it used to be, but certainly can be done, and we do it all the time in our office. Once you're on Suboxone, then it's a question of taking a maintenance dose, taking it as prescribed. Remember the three things that really we look at as recovery if you're on Suboxone MAT: taking your drug as prescribed, not using any other mood-altering drugs so that you've got full capacity for your thinking to be clear and your emotions to be clear, and working a recovery program so that you're learning how to deal with life and not relying on drugs in order to try to find happiness or find solutions. Start finding those things naturally.